feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
I had a kebab knife through that hand
Yeah.
and took my knuckle off.
Kebab knife, did you say?
Kebab knife's worse than a dog bite and a human bite.
Jeez.
I don't want to be, abnormal person. This is better if I go with my sickness and die one time.
So you've submitted a urine sample,
Yeah, urine sample, yeah.
but it was meant to be a poo sample.
Poo sample, what is...
So you need to
Oh,
poo.
oh.
That's where all the problems started.
And you talked about feeling suicidal. What is it you thought about doing?
Just, like, chucking myself under a train.
Would you like to see a doctor?
Yeah, I phoned up and booked an appointment.
OK, what's your name?
Spiritual Park.
Surgery Stacey speaking. Sorry for the delay. How can I help?
Why do I have to do... Oh.
Because it goes out every 3 months.
Why doesn't it warn me that
It probably does, actually.
No, it doesn't.
Well, just put it in again.
OK, well, you have got a locum, but you're on the system. Yeah, you're on the system, and there's 1, 2, 3, 4, 5 patients waiting. Oh, bloody hell. All right, then. OK, bye. OK.
Next available.
Move these over to Ferdy.
Spencer?
Sorry.
That's all right.
I'm so glad to see you.
Why is that?
Bloody marvellous last night.
What was I? What happened to you?
Beat me up Monday or Sunday, broke my ribs, and one member of my family, I won't say his name, hit me because he thought he could do me with bad ribs, so he knew I was vulnerable. And the hospital gave me codeine last night, and because I'm on Subutex, I can't take codeine. I'm sorry, I can't breathe properly.
Yes.
I don't like to lie.
That's all right. I appreciate you not lying. You've been to A&E a lot recently, haven't you?
Yeah, I have.
Good morning, St John's Medical Centre. Sarah speaking. How can I help?
I think everyone's waiting like 45 minutes out there. I'm going to get lynched.
Good girl. Let me just move that chair and then you can reverse into this spot.
Right, push up with that hand. OK? Yeah. See if you can do that every time you get in and out of bed. Are you all right?
Blow. Keep going, keep going, keep going. Push, 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 push. Go on, you can do it, you can do it, you can do it.
You're gonna kill me, you.
Oh, dear. That cleared your chest, didn't it? Right. When you do stand up and things, do you get short of breath with that?
Well, do you know what? If I was to tell you something, right, you wouldn't believe this. I'm no better off now for giving it up than I was when I was smoking. I've got more problems now. I've got high blood pressure.
Oh, have you?
Yeah, which I never had before.
Well, it's
My cholesterol always goes through the roof. Every time I give it up, I end up with more ailments than they do if I'm smoking.
But just think how better you'll feel in, like,
well,
another year's
a lot
time.
Better.
Yeah, exactly. You got some more dosh in your pocket.
Yeah. I get out and about, because in the winter I don't go out as much as I do in the summer.
No. Mind you, if you had a better wheelchair, you might get out a bit more, mightn't you?
Yeah, well, sometimes if I had a better carer. He's nearly tipped me out the wheelchair on the way here. Him. Yeah. And standing there laughing, pushing the trolley.
Now you're a young man.
Mine's very high, dude.
Get out of it, you're a bloke.
You know,
Oh dear.
Shed nits. Yeah, you can go to the pharmacy and buy some stuff there to get rid of them. We wouldn't really need to see a doctor for that.
I've been getting breast pains since the car accident now.
Yes.
It's become more predominant with pain, more sensitivity, and it's more my right breast more than my left.
Right. I think we probably ought to examine your breasts today.
Yes, please.
Don't you think? You'd have been here quickly if you'd had any lumps, wouldn't you?
I would have been, or I would have gone to A&E if you wasn't here, so I would have definitely acted upon it straight away.
You would have gone to A&E?
If you wasn't here, yeah.
Don't go to A&E.
All right, fair enough.
How long have those doctors been qualified in A&E?
I don't know, not long probably.
Exactly. How long have I been qualified? Ages.
25 years as I've known you, and
Yeah.
I don't know what other on top of that you've had.
What I'm saying to you is, if you did feel a lump, you know, phone the surgery and you book an appointment. You say, I want an appointment as soon as possible, and then they'll fit you in.
Okay.
As long as you're seen within 48 hours if you've got a lump, that's fine.
Okay.
I just need to look in your eye.
Please don't at me.
Look straight ahead at me. Good. Lucky boy. The eye's going to be all right.
Oh, look. That's not my knockout punch. It's my left hand.
Yeah, well, you're holding that a bit
Yeah,
carefully. Is that giving you a lot of pain?
My knuckle's back. I had a kebab knife through that hand.
Yeah.
Took my knuckle off.
Kebab knife, did you say?
Yeah, went through there.
Oh, yeah, I
there.
can see it.
An enemy, believe it or not, jumped over in the kebab shop, pulled a kebab knife out. I jumped over the kebab counter and tried to grab it off him. I didn't know that was double-bladed.
Yeah, they're sharp.
Kebab knife's worse than a dog bite and a human bite. I've got so many scars rolled out.
Yeah.
There. More.
Yeah.
More. But I'm a nice guy.
Right.
I'm sorry.
You can take things like ibuprofen, can't you?
I've got ibuprofen, they're bloody shit.
Yeah, this is stronger than ibuprofen, but it works in the same way. It should help to manage your pain a lot better.
Okay, when I saw your face, I was bloody happy.
Good. Well, I'm glad, Spencer. All right then, Spencer. Take care. All the best.
Oh, well, thank you very much.
No problem. Bye-bye.
You're looking at the nipples. Which way are they pointing? Make sure they both go in the same direction.
Okay.
You're not one pointing upwards and one going downwards. Then you haven't got any nipples that are going inwards.
No.
And you haven't got any what we call dimpling on the skin, so that's a sort of bubble or dimple. Brilliant. OK, you've done very well. Now let's have you lying down. So once you've done that, then you proceed to the feel bit.
If I'm examining a lady's breasts, I'm hoping I'm not going to find anything. But clearly, I've always got to be on the lookout for something sinister.
But basically, your right hand will feel your left side and your left hand will feel the other one.
If you've got to break bad news to somebody, the secret is to always give them a little bit of hope and to break it in little pieces.
And you're feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
Patients who are waiting to see Dr. Corrali, would you like to come forward, please?
OK, so you have an appointment booked for today at 2:45 and you want to cancel it? OK, I'll cancel that. Thank you very much for letting us know. Thanks, bye. 2:45 cancellation, Dr. Savage. You all right, Ferdy?
In everybody's breast, we always find that there's a little bit of breast that creeps up underneath the armpit. It's called the tail of the breast.
Just a little bit of sensitivity under there.
Yeah. You're doing so well. It's very, 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 very good. Very good. The last little bits around the top here. Okay. Well, look, good news, there's no lumps.
Good.
Have a tissue. That was
That did
difficult,
really much.
wasn't it?
That's all right.
Look,
It's okay.
you're being a really brave soldier because Having had that accident, it's made you, shaking you up, it's made you feel really vulnerable, hasn't it?
It has indeed.
I think that knowing your patients is really very important as a GP, because with the time constraints, you've got to decide very quickly on in your consultation whether what that person is coming in complaining about is something very serious or it is something not so serious. Sometimes you don't get it right, but you've got to make decisions.
Okay, so what do you think?
There's all sorts of explanations for this.
Okay.
Could be a hormonal blip,
Mm-hmm.
which has been made worse by the shock of the accident.
Mm-hmm.
If you know your patients and they come in and they look desperately thin, or they look pale, or they look worried, you know that they didn't look like that the last time they came, and so there must be something wrong.
It could be part of the general shake-up. That could be what's making it worse. Okay? But at the moment, I don't see any reason to refer you to the breast clinic.
Okay.
Now, I've looked at you now, give you some anti-inflammatories, and we'll make a point of revisiting this in a month's time.
Okay, that's fine.
You're happy with that?
Absolutely happy.
Good.
Good. Thank you.
Okay. Hi, Jane.
Hey, baby, how are you?
I'm fine. Can't take a seat for me. How are you doing?
You changed your room. You're moving around, woman.
When did we have one done? Yeah. Okay, not to worry. So you get yourself ready for me, okay? And how you been, James? How was your weekend?
All quiet, watched all my sport, the cricket, the football. Yeah, I love me cricket. I want spring to come because I got that discount rail card I paid 30 quid for. And I get a day down the coast. Half price, see? Get a good weather, I can go to Brockley, change at East Croydon, go down to Worthing. I like Worthing.
You like Worthing?
Yeah, nice.
Well, I like Margate, but...
Margate?
Yeah, our friends live in Margate.
Yeah, that used to be the bee's knees, you know.
I know.
Margate, Ramsgate.
Right, relax this down.
Yeah. Oh, you are gentle, darling.
Right, there you go. All done.
Now, don't forget my blood pressure, darling.
You want your blood pressure done as well?
Yes, because I think you've put it up.
Hello, how can I help?
Can I just collect up a prescription for me, Stephen Harmon?
Hartman, yeah?
Yeah, how are you?
Yeah, I'm fine. Rest of the family okay?
Yeah, not too bad, thank you.
Good. When did you put your request in?
Come in. Amanda, how are you?
Never say never.
What is it that I can do to help you today?
Right, well, I didn't realise I was low on my tablets as I thought I was.
Right, OK. So this is mainly a visit to grab some tablets. I'm very confused by your medication list. So I was just thinking maybe we should just quickly fire through it and try and figure out what you are taking and what you're not taking.
I take all of it.
No, I know, but I think there's certain things on here which just... I just want to check. Make sure we're giving you the right things, right?
The amitriptyline apparently should be helping what I've got up going on the top of my neck, and I'm under the physio at Lewisham as well.
Good. How long have you been on the amlodipine for?
Quite a while now, because they've actually put me on another little one.
Is that the bisoprolol?
Yeah. And have they put the morphine on repeat as well?
Well...
Because I've been on it long enough now for it to be on repeat.
Well... Question is, do you want to be on morphine?
Well, no, I don't, but it does help with the pain.
Funnily enough, as a doctor and a GP, I don't want to give out medications to people. I only really want to use them when I absolutely have to.
My body's getting used to the 20/10, that's the only thing. And I know it can go up 2 more times, but I've got this big row with the job centre at the moment as well. They're trying to get me to go back to work, and if I don't find something or tell them that I want something, they're going to sanction me, which means I lose my money.
Right.
Which is not fair on me, because I know that I'm never going to work again. Because when my hands are bad, they're bad. It's enough to make just try and make a cup of coffee, and then she sits there, but oh look, I burnt myself over the weekend. I said, we're not talking about you, we're talking about me.
Okay.
When I first had pneumonia years ago, back when I was about 40, I was working for Iceland, and I was in and out the van, and you put the big coat on, you get sick because you're carrying all these heavy bags, so I'm sweat, got pneumonia then.
Well, some people who though end up in those sort of situations, get colds, etc., they don't get pneumonia. There must be something making you susceptible to pneumonia.
Well,
what do you suppose that is?
I haven't got a clue. You
Really?
tell me.
You don't. No
I'm
idea.
tired. I've only had 4 hours sleep. I had a bad night last night.
A lot of the problems that my patients have can be dealt with other things like exercise, diet, giving up smoking, not drinking so much. Those are the things which actually I need to be influencing and giving advice on in order to really improve the health of my patients.
How many are you smoking?
I've given up.
Have you given up?
Yeah. This might smell of smoke.
I wasn't aware because last month I think we got you down there still smoking and.
No. I think I might have had the odd 1 or 2, but that's it. Because they kept saying to me in hospital, give up. I said, I've given up. What's wrong with you people?
Okay.
I've just done it pure willpower.
Good. We'll see what effect the tablets have had on you, but it needs to be 3 months down the line.
Right, okay.
All right, Amanda?
Thank you very much.
No problem, all the best.
Wreck the joint before I go out.
Bye-bye. Take care.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help? No, Orlean, I don't have anything else today now. It's booked for you at 3:10, but I can't make it any earlier.
Hello, Mr. Gulai. Good to see you again. Please take a seat. Sorry I'm running half an hour late today.
Yeah, so...
What's been happening with your symptoms? Because you had quite a bit of pain, burning sensation after eating, acid in the back of your throat, worse when you lay flat, worse after alcohol. Is that all kind of, am I remembering correctly?
Yeah.
Great. And that all sounds to me very much like acid.
Okay.
I think you had a few concerns that it might be to do with your heart, but I hope I put your mind at ease. There's one thing I wanted to do, was I wanted to get the stool sample, okay? To make sure there wasn't a bacteria that was causing the symptoms you were getting. But what happened was you submitted a urine sample.
Yeah, urine sample,
But it was meant to be a poo sample.
Oh.
So the urine sample, that didn't help, and then you didn't pick up the prescription.
Yeah.
So we kind of haven't really moved on as I would have liked to, but it's not a problem.
All right. So I don't need to fast for this one, huh?
No. This is just a poo sample.
Yeah.
But
what is poo sample? What's that? It's poo.
So you need to poo. That's where all the problems started. You gave me a urine, a pee sample, but I needed a poo sample. Okay, a stool sample. So yeah, feces. That's what we need, because that can tell me whether there's bacteria in the stomach. Sorry, I wasn't making that clear.
Okay.
All right,
No
so
problem,
that's the key. That's the key. I'll be upset if we get another urine sample.
No.
Blue for poo. Easy to remember.
Okay.
All right.
What's his date of birth, please? And is this rash just come up where?
I mean, I can do a letter for you that says about the fact you've got epilepsy and about your other conditions as well. And then you talked about your mood. Tell me more about your mood.
I've been feeling really depressed lately because of a lot of personal issues. Everything that pretty much could possibly go wrong in my life has. I've been feeling kind of like suicidal at points as well. And just sort of like come home and like cry every night pretty much, and not feeling sociable at all. Don't really like go out, and I just feel like really down.
And then what specifically happened? So you said that there've been some things happening, but what's happened?
My granddad died, and
I'm sorry to hear that.
my brother was stabbed. My mum and my stepdad are getting divorced, and plus my boyfriend also is in prison as well, so that's quite stressful. and just sort of, I feel like I'm under a constant battle with like my sort of conditions and stuff. And like I just feel so worried.
You talked about feeling suicidal. What is it you thought about doing?
Just like, because I just don't see the point of going on, because I just don't have no one there for me at all, just to comfort me even. Not even, because I'm not really much of a talker anyway, just to like have that bit of comfort, you know, just to have a hug and say everything's going to be all right kind of thing. And so just like ending it really.
What is it you thought of doing to do that?
Just like slitting my wrists and just like chucking myself under a train. Okay.
How's your sleep?
Not good. I've never been a good sleeper anyway, but there's not really a lot I can do about it because of the medication that I take for my epilepsy.
And you talked about feeling suicidal. Would you ever act on these thoughts? Would you ever act on those thoughts?
No, because I'm not a selfish person, and I know that I'd cause a lot of hurt to a lot of people if I'd done that.
This is important if you are feeling suicidal, that you need to let us know or someone else know, because we don't want to see any harm coming to you.
Yeah.
Yeah.
But I wouldn't do that because I'm not a selfish person like that. I wouldn't do that to them.
Have you suffered with depression in the past?
Yeah, but like not on, like, you know, bad things have like gone on, but you know, it's just not onto the good way that I feel at the moment.
We can refer you for counselling here if you want.
I've never been a great fan of counselling because I'm quite a private person. Like I said, I'm not really much of a talker. I'm just, I can take everyone else's problems on board. Like, I'm a great listener, and I could just sit there for hours for someone talking to me and listening. But I don't really like the idea of just talking to some random person.
And have you thought about anything like antidepressants or medications? Is that something that you've thought about?
Yeah.
So one of the theories behind when people get low in their mood or depressed is that one of the chemicals in the brain is low. So antidepressants help to boost up that chemical. Quite often, you have to take them for at least a month before you might see any benefits of taking the antidepressant. You can get side effects. Common side effects with antidepressants tend to be nausea, vomiting, stomach upset. Some of them can cause problems with vision as well.
Okay.
Antidepressants, I wouldn't say that they're a long-term solution. I think they can be good to help get people out of a rut as such, you know, in combination with other things as well, because you've got to look at different life aspects, and if there's something that's making someone feel depressed, to deal with that as well.
I guess it's something I can try.
Yeah, are you wanting to try one?
Yeah.
Yeah.
Quite a big proportion of our patients that will come in with, you know, either depression or feeling low in their mood or anxious or in a distressed state as well. On a daily basis, I might see maybe 5 or 6 patients that are going through some sort of form of distress.
Because of the other medications you're on, I just have to double check about what we can give you.
Okay.
I'll get back to you at lunchtime today.
Okay.
All right then.
Okay, thanks very much.
All right, good to see you again.
St John's Medical Centre, Sarah speaking. How can I help?
Hold on, I can't. I need some more details. Could you tell me what the symptoms are, please? She's coughing, so she's got a cough.
Just breathe normally. I'm listening to your heart. Okay, good. Chest is nice and clear, your heart sounds normal. The first thing to say is you don't need antibiotics.
Okay.
What you have is a cold, so it's a... Well, it could be flu, but even if it's flu is caused by a virus, and antibiotics don't work.
You haven't got no antibiotic I can take for sore throat?
Nothing, it wouldn't work.
Really?
Yeah, your sore throat's going to get better on its own in 2-3 days.
Serious? No antibiotic? That's what I've come here for.
I'm afraid I've got bad news for you. Cough can last 10 days to a fortnight at least. Giving antibiotics doesn't help the cause. No antibiotics for the moment. Self-help, steam, lozenges.
Okay.
But I haven't got any magic wand.
Just say, Wow, that is pretty clear cut. So that tonsillitis is so bad, you definitely need antibiotics. I mean, that's a clear cut case. So if any one of your friends asks you, doctors don't like to get antibiotics, that's the kind of classic case where you need antibiotics. It's pus, it's very swollen, your glands are clearly up. If those tonsils get any bigger, like if you actually find that, you get a kind of ooh, that kind of noise, any hint of a noise like that, you have to take yourself down to A&E.
Does the fact of smoking affect it?
Smoking's not going to help it one bit. Had any thoughts about quitting smoking at all?
Yeah, I've tried it for a week.
You tried it for a week? How many would you smoke a day?
20 a day.
20 a day. Before you're 30,
yeah.
If you just stop now, that's £26,863.
Yeah.
How much pleasure does smoking really give you?
Calms the stress.
Not as much as a £26,000 holiday, all expensive paid.
Yeah, but that's like in 10 years. Though.
Well, but this is still real.
Great. Got a gap. Woohoo. Somebody not turned up. Marvellous. Perhaps I can grab a coffee.
I'm going to go and eat some cake now. Bit of gattox.
I can help you today, Joy.
My mum passed away last year, February. I hadn't really grieved. I ain't seen counselling or bereavement classes. I just haven't got time, to be honest, and that's me being honest. And I've got to be strong for my kids. I come up with some little rash just before Christmas, and I'm trying to keep my stress levels down, but my armpits are sore where it's flaring up there now. Crease in my arms, it's sore. My neck is sore, my face is sore, and that is stressing me out because my eyelids are getting itchy and sore. But my face has taken a piss. That I'm going to get stressed because it's really tender now.
Yeah. Okay. Do you want to pop your jacket off and let's start by having a look at your arms?
I've never suffered allergies. I don't know what's caused it. I don't think I've dealt with stress since I was 8. My mum's had asthma, diabetes, high blood pressure, blood clots, arthritis, and rheumatism. I've dealt with stress. I've never had nothing like this. It's already sore, especially this part of my belly.
Yeah.
It's like it's inflamed. And I don't know what it is. My friends keep telling me it's not psoriasis, but I don't know. I've never had skin allergies.
Yeah, so there's different types of psoriasis that you can get, and where you get the big flaky bits, that's called chronic plaque psoriasis. This looks like a slightly different version of psoriasis.
Is this common?
No. I mean, by far the more common version is the chronic plaque psoriasis. This is different, yeah, and
will this go away, or am I stuck like this for life?
No. We will get rid of this for you. Don't worry. It's gonna be better than it is. This is not satisfactory for me or you.
Anna, this was the girl in cool back.
Who is she?
The same one that you just spoke to.
What she want now?
The same thing she's arguing about.
Same question, Ella. Same question. The answer doesn't change.
Yeah, it's a call back.
Yeah.
Which day did I last come to the surgery?
That might have been the dad, that phone, because the dad sounds like a woman.
No, the daughter.
The dad's got
She's
a
very
woman
rude. It's a rude family.
Because one time, out of courtesy, I phoned them about Dr. Parker's appointments, and he went on and on and on and on and on and
St. John's Medical Centre, how may I help?
The phone rang twice, Colin.
I mean, psoriasis, if we're treating it correctly, it improves, but it doesn't improve like in a week. It takes like 4 or 5 weeks of sustained treatment, which
That's
is
what I heard. It
working.
would take 5 weeks. That's what the hospital told me. 5 to 6 weeks.
The one thing that I would add in, which you haven't had yet, is a steroid. And I think that would really help with the soreness and the redness.
Okay.
As, hopefully, the sun comes out a bit more, and we will encourage you to get out in the sunlight a bit more as well, because sunlight helps to improve this as well.
What about sunbed? I've never used it before, but I jump on it and that to get rid of it. I'm serious. I don't need to use it, but I jump on it if it gets rid of this.
Yeah, it probably would.
Probably would.
It would probably help. Yeah. That's not to say go mad on sunbeds.
No, I wouldn't go mad. I don't need to go mad. I've got an all-year-round tan. It never peels, never fades. But this is annoying me because I don't suffer from no allergies.
We will see what happens over the next couple of weeks. Like I said, if you feel it's getting worse, just come back and we'll get you seen by the skin specialists.
Okay then.
Great. And yeah, I mean, ultimately coming back to, you know, the stress that triggered it all off. I mean, is the loss of your mum, is that something that you think you would like help with at some point? Or?
To be honest, I do security. I do between 60, maybe 80 hours a week. I physically ain't got time.
You ain't got time.
Yeah.
Life's in the way.
But I'm all right. I know my mum would want me to be strong.
Really fill your boots. Go. Keep going, keep going, keep going, keep going, keep going. Keep going, keep going, keep going. Keep going, keep going, keep going, keep going. Keep going. Stop.
Hello, sir.
How are you?
I'm good. How are you?
I'm all right.
Last time we met, you were due to go back and speak to the surgeons about the operation for your colitis. Any further thoughts about whether you would consider the surgery?
You know, I don't want to have a surgery. I don't want... You know, they want to take all of my bowel out.
I know.
Which is wrong, you know. I don't want to be, you know, abnormal person. This is better if I go with my sickness and die one time. That's good, yeah. But I don't want to look, you know, someone who is abnormal, to have a bags every time. I don't want it. You know, I hope that I will get better or die, you know.
Think about it this way.
I will.
You know, if you have an operation, you don't have to worry about being up 5-6 times a night, always needing to be near a toilet, constant blood, and the diarrhea. All of these experts, they're pointing towards the same thing. Yes, you'll have a bag, but in day-to-day life, you know, that's something that you'll become accustomed to.
I know only what you think, but still I believe that I will get something before that.
What do you mean?
You know, or some technology will come, or it comes by itself. So maybe it will go by itself.
That's a very optimistic point of view. However, we haven't seen any miracles yet. There are no cures. This has been the standard management for many years.
I will think about it. Let me think about it. Let me see. Yes, it has not any other option. Then, of course, I will go. But let me, yeah. Okay. Let me think later.
Would it be possible to see a doctor today? It's a bit serious. I found some blood in the urine.
Okay.
Because it's a bit worrying, you know.
How are you feeling today?
When I'm lying and I keep tossing and turning in the bed because of the pain, the bandage just go down, you know what I mean? And sometimes when it goes down, it gets tight down the bottom.
Is it painful still down here?
To be honest with you, it's painful from the stump of the big to go around. God.
I've injured my foot. I went quite a long walk on Saturday, and I think the boots are rubbing on this big toe. It was a massive blister.
Let's have a look at it. What I think we'll do, because it's a hot, sweaty area, you've got an open wound, there's a huge potential for germs to get in.
Right.
And what concerns me is if there is a bit of redness, is this the first signs of an infection?
So what I'm going to do, Mr. Phillips, this bit over here, just going to put a bit of Inadine on that, okay?
Twice a day,
Yeah.
you put that foot in hot, soapy water, not too hot, so you wash it really thoroughly.
Yes.
Then you dab it dry, or use a hairdryer to dry it.
Yes, yeah.
So that it's completely dry.
Yeah.
And then you put the antibiotic cream that I'm
Yes.
going to give you, and then you can cover it with a suitable, appropriate plaster.
Okay.
You okay?
Yeah, come.
This is just on lightly, okay? There you go. You feeling okay?
I'll never feel okay, really, will I? Oh.
Doesn't hurt there?
No.
Doesn't hurt?
Could you do me a wee?
Now?
Yes.
Right.
No time like the present.
My name is Dee. And
Thank you, Dee.
And you too. Now, this is just a health check, very basic health check, OK?
OK.
If you have any medical problems, then it would be a GP that you make an appointment with, OK?
Yeah.
So where have you moved from?
From Greece.
Straight to London?
Straight to London.
Oh, how long have you been here?
About 4 months.
What do you think?
I love it.
Do you?
Yeah, I love English people in London.
What made you decide to come and live?
Here, it's so big, your country is so big and there are many opportunities.
Yeah,
and
true.
the thing is that you are organized.
Do you think so?
Yeah, I like organized countries.
All done. Finished.
I've had an awful lot of trouble with this printer here. Just don't seem to be able to get it to work.
So what's wrong with this? Oh my God! Oh, you don't know how to use none of the equipment them in here.
Yeah, no, you
and
have to
all you girls.
Sure. You trying to hide? Huh? You trying to hide from me?
Come and have a seat. Hello. How are you these days?
Oh, well, most things are fine.
Yes.
Same old, same old. My sleep.
Oh.
It's terrible, and I've not had a good night's sleep for a couple of years.
You've got to a sort of certain age now.
Oh, God, yeah.
Do you think the menopause has got anything to do with this?
Oh, yes, I do.
Are you
But
getting
I think
hot
I
flushes?
did. I was.
Sometimes it helps, to cope with the lack of sleep, to have what we call some talking therapy.
Yeah.
We've got some superb counsellors, if only just to sort of help focus on how you feel and how you can cope when you haven't got any energy and
Yes, all the
you can't
time.
get through work.
All the time.
If up here is not at peace with the world,
Yeah.
how can you expect to get a good night's sleep?
Yeah.
OK, well, have a think about it.
Right.
But let me put this to you. We're not superhuman, and just sometimes we need something to kickstart us into feeling better.
Yes. Yes.
I've known you long enough to know that actually you have been coming to me with this problem.
Yes.
And perhaps now's the time to try different tacks.
Yes.
How does it affect you? Like, are you aware of it? Are you conscious about it, or does it not bother you?
Doesn't bother me.
Doesn't bother you. Okay, good. I don't know. Did my colleague tell you it's called pityriasis alba?
Yes.
Yeah. With this type of pityriasis alba, unfortunately, there's nothing that we really know kind of makes it better or worse.
Maybe antibiotic, maybe.
It's not anything to do with a bacteria or an infection or anything like that. It's getting better, and hopefully at some point it will be gone. What I will do, I'll give you a tiny little bit of hydrocortisone, 1%.
Okay.
And you can put it just on these patches around there, not around the eye because the eye is very thin, but just for 3 days, just once a day, just for 3 days, and then don't use it again, and just see if that makes any difference. Some people say it does. Any other questions? Is there anything that's worrying you at all?
Anything question? Just put it. Soak. No.
Are you interested in anything to do with those leaflets? Your mum will be even more worried.
I need them.
Do you?
I want to read it.
Are you just reading out those for interest, or is there something you want to talk to me about?
No.
You sure?
Mm-hmm.
All right, okay. Well, the door's always open if you ever want to come back and talk to me about anything from my broad selection of information
young
leaflets.
for know about that?
Yeah, I think so.
You'd be surprised how frequently patients will come in and they won't actually tell their doctor why they're there, and it's really important that we know about that, and we do have a term for it. It's called the hidden agenda. Essentially, your main tool for everything is listening, and there will always be cues.
So you basically just tick that box and hand it in. They'll pull Telus off and just hand it in. Okay, when you need another one.
Also, the body language. If someone looks uneasy or they're avoiding eye contact, you just pick up on things.
Nice meeting you.
Thank you.
Take care.
Bye.
Do you want to talk to me about it?
No, I just need it.
Can you just give me 1 second? I'm going to ask your mum. Do you mind if I have a chat with you alone for 1 second? Without your mum, would that be all right? Do you mind if I just have a quick chat with Semi-Solo alone, just for 5 minutes?
Okay.
Yeah?
It's really important that young people and children feel able to speak openly to their GP, and sometimes that'll be about things that they certainly wouldn't want to speak openly about with their parents, for example. And I think it is important sometimes, even if someone is, say, under the age of 16, to have a moment of privacy.
So, the ones you were looking at were these two. What was it that made you think that you might need some of these?
I don't need them, I just need to get something. I can't reach it.
What do you mean get something?
I dropped something
Whereabouts?
in the heater.
And you want one of these?
I need to get it. I've dropped my 50 pin, I need to get it.
Okay, so you don't need anything, you don't know what these are all about, and you don't think you need what these are?
Just grab them.
All right, okay.
But obviously, yes, sometimes our intuition isn't spot on.
Well, you know what? I'd rather you didn't use my information leaflets to get your 50p. Maybe try a ruler. Do you have a ruler at school?
Yes.
Maybe use your school ruler or something like that.
Hello, Gypsy.
Would that work?
Yes.
All right. By all means, have that. Okay? Take care.
Bye.
Cheers. Nothing to worry about, okay? Take care.
Okay, thank you.
Oh dear.
All right.
Friday.
Has she offered any explanation as to why she's, 25 minutes late? 25 minutes late. I mean, I'll see her. It's fine. Okay, bye.
The guy told me that half of the heart is not working.
Yes.
I stood up and all of a sudden I felt I was drowning.
I've had pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That's where I do have the pain.
When was the last time that you had sex?
It's a month ago.
Was it with a regular partner?
2 people besides this girl, but they're all regular. Oh God, getting pain, getting worse and worse and worse. I can't understand it no more. I can't even sleep.
morning, surgery. Good morning, St John's. Can I help you?
Could you come for this morning, 9:20?
Your breathing seems a bit better.
It is.
Good.
So I've had a few days where I've gone and not had any cigarettes, but then there's been other times where the craving's just been like so much that I've had one, but after a couple of, just took a couple of pulls and thought it's disgusting and kind of just got it out of my system.
Where are you getting the cigarettes from to have the odd one?
Well, it just happens to be a drawer.
Right. Which I'd like you to go home today and have a ceremonial emptying into the bin.
That's the fear bit, because I'm thinking, what if I really, really do need one?
If you were addicted to heroin, would I say to you, go and just put 5 ounces of crack heroin or whatever in your drawer just in case you need it? Would I say that to you?
No.
So why would I say that to you with cigarettes?
You wouldn't.
No, you wouldn't, would you?
I'm saying it to myself.
Again, it's another thing. You're setting yourself up to fail.
Okay.
So get in there and be
All right.
positive.
I will do. Promise you.
Right.
I'll go home and get rid of it.
Get rid of it.
What's the date of birth?
8/10/35. No, it's a sister, sorry. 8/10.
Can you bend forward and touch your toes for me? Right.
Ow!
And up.
Sharp pain. It's like every time I move, stabbing me.
How severe would you score it on a scale of 1 to 10?
I would say 9.5.
How much movement have you got in this arm at the moment?
I have movements in it. Ouch.
Hello, sir. Good afternoon. Go on in. How's 2014 been treating you so far?
Well, in December, I spent 16 days in Lewisham Hospital.
Very sorry.
And now I'm on oxygen.
You're on oxygen at home now, are you?
16 hours a day.
So how are you finding that?
Oh, there's been lots of funny things happen. Your nose runs. Initially, it was bleeding. My throat's gone. No, it was not very funny, really.
No.
Not at all.
It's not a nice thing to happen.
What shocked me was they said I had pneumonia.
Well, yes.
And I'd come down with a cough, and I had pneumonia and a heart attack. But it was the breathing bit that got me, because I don't know what it's like to drown, but by golly, that was the impression I got on that Friday morning.
Yes.
I stood up, and all of a sudden I felt I was drowning because I was trying to grab air, and my hands were going, trying to. It's frightening.
I think my biggest frustration is feeling that I can't help my patient because their problem is too complex. But the key thing that we do is we listen and we try to understand what problems that the patient is coming to us with, and we try to work with them to try and find the best solution.
The guy told me that half of the heart is not working. And it's not being able to pump the blood round, so it's, the lungs are not functioning properly to do the job.
Well, look, put the jacket on. Let's have a listen to your chest and see what's happened. See what's going on. Deep breaths in and out for me, Brian. Good. Turn around for me. Let's have a listen at the back as well. Go, deep breaths in and out. Good. Have a seat for me. Your chest sounds good. It sounds clear. You're getting lots of air in there, and so that sort of ties in. You can breathe. You're not feeling short of breath. That's all very positive. I imagine that the cause of a cough is the oxygen. It's drying things out and making you more likely to cough. I think the heart failure nurse is the right person to ask about getting reassessed to see if it's really needed or not, because it sounds like it may not necessarily be needed.
God, it's been a long 6 months, and I'm quite honest with you, it did bring me down.
Yeah.
And no one seemed to care anymore. I still don't, but what the hell?
Right.
Anyway, doctor.
All right, Brian. Nice to see you. Take care. If you're having problems, call me, yeah? You don't have to always come down. Just give us a call.
You take care, mate. Bye-bye.
Bye-bye.
Make sure you're doing enough weight-bearing exercise, walking,
Yes.
skipping, running, whatever you want to do that's weight-bearing.
The symptoms are classic of asthma. Nocturnal wheeze, chest tightness.
It's positive. You're pregnant, my dear.
We're talking about signs of serious infection. Drowsy, dopey, can't wake her, or the opposite. Hey, what's that? What can I do for you today?
For the past week or so, I've been getting really bad headaches. And then it kind of started to get worse Monday when I started to get migraines.
So when you say it started as a headache and then became migraine, what do you mean by migraine?
Migraine as in severe pain either at the front or the side of my head. And I usually always end up throwing up.
Is it a constant headache or is it coming and going?
It's a constant one. It's been constant since Monday.
At its worst, what sort of state does it reduce you to? Are you having to get into bed and...
Yeah, literally, I will be in bed with the duvet over my head.
Okay, and any other symptoms like cough, runny nose, diarrhea?
Diarrhea, yeah.
You had a bit of loose stool as well?
Yeah.
Okay. One more question. Is there any chance you could be pregnant?
Morning surgery, Stacey speaking. How can I help?
I have to see a doctor tonight.
Yeah, I will ask the doctor, but you are 35 minutes late and you may have to rebook.
When was the first day of your last period?
It was the middle of last month.
So that would make you a little bit late, maybe? Do you often miss periods?
Yeah, because of my pill.
Oh, right, okay.
Yeah.
And are you pretty good at taking it the same time every day?
Yeah.
You don't forget? No. Just to be on the safe side, I think it's worth doing a pregnancy test. Do you think you could pee for me?
Yeah.
All right, if you take that to the loo and then just come on back straight to my room.
Hello, good morning, surgery. Can I help you?
Seems to be very busy at the moment.
I can see that.
Come in. I think what I'll do is send your urine off. There's just a little trace of white cell, which, you know, in the absence of any definitive diagnosing, especially you're a bit tender over your bladder, we'll send that off to make sure there's no infection. But it's difficult to say whether the headache is causing the nausea or whether all the diarrhea and nausea is causing the headache.
Yeah.
What we can do is maybe give you some anti-sickness tablets, see if we can settle things down, give you some painkillers, and then see how you get on.
Okay.
Pregnancy test is negative.
Don't need a kid yet.
Good morning, St John's Medical Centre. How can I help?
Now, as I've explained to you, and I'll explain it again, there is no appointments with Dr Vash till Wednesday.
You're breaking up. I can't really hear you. I'm getting an odd word here and there.
I can't hear you properly, sir.
Do you know what? I can't hear you at all, I'm afraid. It's a very bad line.
You can have 3:40 or 4:20 this afternoon with Dr Nav. Would you like that appointment?
I'm Dr Parker. What's the matter with you?
I fell quite badly and I hit my knee, my leg and my ankle. And after, well, it was a bit painful, of course, for the week. But then when I woke up Sunday morning, there was like a blood effusion inside the knee, so it was like all black. I couldn't be sure that if it was
So you
because of
fell on the ground?
Yes. And then there was some gentleman kicking me. And I can't be sure if that was because of the fall or the other person.
Your head wasn't injured?
I had a slightly kick as well on my head. I
You
think,
weren't
but-
knocked out?
No. And ankle as well is still a bit blank, but and I think it's still swollen.
Shall we have a look at them, I think?
Sure.
Does your job involve walking or standing?
Yeah, I'm a waiter.
Yes. But is...
I've been working all week and I've been walking. The walking is not really a problem, standing.
It is, yes.
It's
Good.
not.
OK,
It's more
let's
like-
pop you up on top here and have a look. One of the things that you ought to do straight away is put some ice on, because it stops the bruising, it stops the damage to the knee. And now I'm going to ask you to take your trousers off. That's a pretty colour, isn't it? My goodness. I'm sorry if my hands are a bit cold. Fortunately, I think there's no fluid in the knee joint at the moment. If I move round here, is that hurt? And what about the back? Is that all right? No. Now, I'm going to take it like that and I'm going to twist it. OK, now, I'm going to just pull on your leg. And I'm just going to push.
It's okay.
Look, I think this is just bruising. That means soft tissue injury, no broken bones. I don't see any reason for sending you for an X-ray. So I think that's just going to get better on its own slowly.
Come in. Hi, Mr. Lennon, good to see you. Sorry I kept you waiting such a long time.
Is it possible to get a glass of water, or I feel a bit faint?
Yeah, sure, take a seat.
I feel really light-headed.
Not a problem, you take a seat there, I'll be with you in just a second. I've got a patient with me, but
Oh, right.
you can bring him in if you
OK,
like.
I'll move them into my room and then I'll come into your room when you're finished, all
OK.
right?
I feel really peculiar all of a sudden, I don't know why.
Have you been feeling like this all day? Is that why you've come to see me, or is it just happened now?
No, it just happened out loud. I just come over and I feel like light-headed.
OK. Ever had an episode like that before?
No.
Ever fainted?
When I cough too much, I faint. I pass out, which has happened, I don't know how many times, but...
Any feeling of your heart's racing at all?
No, but I'm getting all hot and I feel a bit sweaty and cold and I don't know.
OK.
Very odd.
Do you mind taking your jacket off in a minute so I can just check your blood pressure? What was it that actually brought you here to see me today?
I'll need my doctor's certificates run out and I need some of my tablets, some more tablets. Oh, sorry, I feel really strange.
Just relax. OK, just roll your sleeve up for me. OK, do you mind just standing up for me? If you stand like that... You do?
Yeah.
And is it a definite dizziness, or is it the actual room spinning?
I feel light-headed. I don't know. I can't really explain it.
Sorry, let me just get this.
I've been sleeping funny as well. I haven't been sleeping too well.
Do you find yourself falling asleep? Like at times when you wouldn't expect to fall asleep?
Yeah.
Do you mind just sitting on the edge of the bed for me? And anything else changed in your life over the last couple of months?
No.
No? Got into any bad habits? Drinking too much, or...?
I do drink beer every day.
How much alcohol do you drink?
About 5 cans, 5, 6 cans.
5, 6 cans. Of what kind of drink?
Stella.
Stella. So that's, what is that, 5.4% or something?
5.
5%? Yeah. OK. Would you consider that too much alcohol? Do you know that's bad for you?
Yeah, I know it's too much alcohol.
How long have you been drinking that much, do you think?
I don't know. A long time.
6 months? A year?
More than that, probably about 8, 9 years.
Do you drink alone?
Yeah.
OK. And do you live with anyone else?
No, it's by myself.
OK. Do you mind just sitting down, lying down flat for me?
Yeah, there's a little bit of pain there.
Yeah?
A little bit.
I think, if I'm honest, I think there's a few factors. Did you have 5 lagers last night?
Yeah.
I think if you've been drinking 5 lagers, cans of lager every night for 9 years, you guarantee you've done damage to your liver.
Yeah.
Giving bad news to anyone isn't an enjoyable part of the job, but unfortunately it's something you have to do on a regular basis, and there's no beating around the bush. You have to be completely honest. It's definitely a regular part of the GP's job.
If someone drinks that volume every day, you can't just suddenly stop because you can get into problems with withdrawal. But you certainly do need to cut down, and that might be changing the routine from 5 drinks a night to 4 drinks a night for a period of time, down to 3 drinks a night, and take it from there. I can't tell you that you want to stop, but if you feel like you're ready to stop or you want to think about cutting down, these are the people that are going to be able to help you. I mean, does that sort of scare you, or does it stress you out, or what are your thoughts on what we just spoken about?
Yeah, it does kind of scare us, because I know I'm drinking too much. But I think it's just because I'm always in my room, my bedroom. I never go out, I never do anything. My legs always get giving away, or one day it's okay, the next day it's not. I think it's just that, because I've been like stuck in the house for like nearly 2-3 years now, you know, not being able to do anything. So I go out now and then, but not as much as a normal person would for my age.
I'm sorry you had a tough time lately, but I'm glad we've kind of stumbled upon it almost by chance, because it means that we can got the opportunity now to try and improve your situation a little bit, not just with your health, but also with, you know, how you feel in yourself and your outlook in life in general, really. Our priority now is to get the blood test done, sort out, see where we are with the liver situation. But next time I see you, hopefully you'll be able to tell me that you've cut down a little bit, and then we can take it from there.
Any alcohol?
Yes.
On average, what would you drink in 1 week?
Probably 5 or 6 pints of beer, I'd say.
Would you have 8 or more drinks in one sitting?
8?
Yes.
No.
When you're drinking every day, the risk can be high, and the liver doesn't tell you it's not well until it's really, really not well.
Good morning. How are you?
What's different to this one and this one?
There's a Meprazole 20 milligrams, and on the back of this it says that this is a Meprazole 20 milligrams. So they're exactly the same, but just made by different companies.
But different colour, that all?
Yeah, but it's because they're made by different companies.
Yeah.
It's like Coca-Cola and Dr. Pepper.
Exactly the same.
Pretty much.
Exactly the same. Dr. Vernon, I can't help it no more, mate. I tell you. Getting pain, getting worse and worse and worse, mate. I can't understand it no more. I can't even sleep.
The likelihood is you have these things called adhesions in your tummy. Remember I said that?
Yeah.
So that's where things stick together, and then you might get some pain from time to time. But it's very difficult to treat that sometimes. The MRI scan's an important part of it, and that will show up if there's anything going on.
I'm telling you, it's very, very painful. It's not only one here. It's here to here, right? Oh, God. I can't even understand the doctor. I tell you, I bite my tongue up, I will. Because now this one not go away. Not go away at all, Doctor.
So the pain's a bit worse than it was.
It's getting worse and worse and worse.
Well, that's why it's important that you've had the MRI scan, and now things will get followed up. In some ways, it's a bit of a pity you missed that gastroenterology appointment that I organised late last year.
I know. I can't help it no
Once
more.
I have the report, then I can decide where to refer you to.
Yeah.
Okay.
All right. All right, thank you very much, Dr. Bernard, yeah? Thank you.
Bye-bye now.
All right, thank you very much.
Take care.
What might be a good idea is just to announce, you know, that they're running late, so we're not just sitting there waiting.
How your water works? You peeing normally?
A bit more than normal.
Are you going to the toilet more frequently at all?
I do suffer from dribbling.
Yeah. Does he have any problems with going to the toilet when he goes for a wee?
No. No.
No, no problems there.
I'm Dr. Trin. What can I do for you today?
I've had pain under my testicles.
Under your testicles?
Yes, just on the left side of the testicle. That's where I do have the pain.
Is it there all the time, or does it come and go?
It comes and goes.
And when it comes on, does it feel like aching, or does it feel like stabbing or a shock pain?
Aching.
Aching, okay. Is there any problem when you pass urine?
No.
No, no burning, stinging, no blood?
No, no, no.
Do you ever get any discharge from the penis? Anything leaking from the penis?
No.
Any creamy anything coming out?
When I'm not peeing.
Okay.
No.
All right. I'm going to have to examine you down below. Would you like me to call the chaperone? Yeah. You want someone else in the room?
Somebody else in the room.
Because I'm a female doctor.
No,
okay, I will ask somebody to come in.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help?
The thing is, the baby clinic finishes at 2:45.
Hello. How much do you weigh?
I've got a patient on the line. Her baby is a year old and he's come up with a rash. She's quite concerned about it.
Can you point to where the pain is?
This.
Okay, so it's the it is the testicle. All right. So I'm just going to examine here. Any pain where I'm feeling?
No.
Okay, all right. That's fine. Let's get you dressed again. There are lots of causes of that kind of aching pain. One of them is an enlargement of blood vessels by the testicle. So I think I will request an ultrasound. What we should do is maybe do a few more tests. I'd like you to do a urine sample for sexually transmitted infections, just to rule that out. Is there anything you want to ask me?
I was asked to do some tests.
Okay, so they were just some routine blood tests.
Yeah.
Fine, so let's have a look at the results. Your cholesterol is okay, liver function is okay, kidney function is fine, and we did an HIV test which was negative. The test, however, it doesn't detect if you've picked up HIV within the last 3 months because it takes that time window for the results to show in the blood.
Okay.
So, when's the last time you had sexual intercourse?
Say a year plus.
Okay, all right. That tells me that as of 3 months ago, there was nothing positive.
Nothing.
So if you've abstained from sexual intercourse for that time, there's no reason we need to worry.
Okay.
Okay, so once you've had the ultrasound, give it about a week for the result to come back to us, and then book an appointment to come back and discuss the findings.
Okay. Thank you very much.
Okay, my pleasure.
Yeah.
Take care.
Bye.
Bye-bye.
Hello, Doreen, come in. How are you?
I'm not too bad, thank you.
Good, what can I do for you?
I seem to have been bitten by an insect.
Oh, where?
On the leg, I'm afraid.
Doreen, you poor thing. Put your foot up. You need the antibiotics.
Antibiotics?
Absolutely, it's spreading. Look, all that redness. The actual strong red bit's about 3.5 centimetres by 1.5. When did you...
Yesterday.
Oh, good. And that's come from yesterday?
Yes.
Did you feel the little biter?
No, I didn't feel anything.
You never see them, usually, do you? Well, it's pretty powerful, isn't it?
It is.
Now, because that's a difficult part of the body to heal, it means you've got to be jolly careful with it. Try not to bump it, put it up the foot, and watch it. Sometimes it's worth even drawing a barrow mark where the line is, you know, like along here, because that should start to get smaller over the next 2 days. If it's not, you've got to ask to be seen by the emergency doctor, because that's serious. You know, if it's getting very much worse, you're going to need intravenous antibiotics.
Oh.
But hopefully none of this is going to happen.
Okay, great.
Oh, dear.
Now, all you'll hear is different sounds. The slightest sound, Joyce, from this ear. Right. You say yes. Here we go, Joyce.
Okay, and I'd just like to follow my finger, keep your head still. I'm just going to shine a light in your eye, if that's okay? Up and down.
Yes. Yes.
Well done.
What's the problem? Do you know what the problem is?
Yes, in my throat.
It's got a sore throat and a bad cough. How long's it been there for?
Michael?
I think at least a week, isn't it? A week?
Yeah, that's a week.
Let's have a look in your throat then. Give me a nice big like this.
Yeah.
Oh, wow, that's really good. Let's have a look here. Say for me. Beautiful. Good. Everything looks really good back there.
Yeah.
Yeah. Let's have a feel around your neck here. Good. Do you want to just pop your jacket off and let me have a listen to your chest? Right, let's have a listen to your chest then. Okay, deep breaths in and out for me. Excellent. Stay there 1 second, hang on. Right, all right. Do you mind if I check your blood pressure whilst you're retaining?
No, that one got quicker.
That's got the fistlet, all right.
Hey.
Thanks for reminding me.
Reckon I won't, Michael.
I'm glad somebody knows what we're doing today. Right, there you go. You can watch the numbers go up.
Your blood pressure is 123/76, which is
Yeah,
perfect.
Marco.
That's perfect. You're very happy with that?
Yeah.
So that's very good.
Yeah.
In terms of your sore throat and cough,
Yeah.
I'm not worried at all. I
No.
think it's just a straightforward cold, a bit of a virus, which you're going to get better from all by yourself. Now, as part of our normal tests in looking after your kidneys,
My kidneys, my mum kidneys.
your ones. Your kidneys
And my mum.
and your mum's.
Yeah.
I was wondering if we could get a sample of your urine.
Okay.
Which just means that you need to do a sample in there and hand it into the reception on your way out. Okay?
Yeah,
Was there anything else I could help you with today?
No, I think that's it. Thanks.
All right?
Yes, Marco.
Right, okay.
Take care, Tony. All the best. Lovely to see you again.
Yes.
It's okay, Michael. Bye-bye. Bye, Tony.
Sorry to keep you waiting such a long time. Please come and take a seat. So it's been I think I last saw you in December.
Yeah.
When you just got out of jail.
Yeah.
And how have things been going for you over the last few months?
Oh, last month been more down and up, getting low again, getting very depressed.
Mm-hmm.
I don't know.
All right. Sorry to hear that.
You get to a point you don't want to do nothing, like, you know what I mean? If I'm talking to someone, and it's the first thing that would come into my head is how can I get out of the conversation without talking to them? And sometimes when I talk, I have panic attacks and that, like, you know, I just burst out sweating and things, like.
Well, last time I spoke to you, we spoke quite a bit about your mood, and you were quite optimistic that things were going to be all right, having got out of jail. Have you been slipping into any of the other sort of bad habits?
No, I haven't been using drugs and it's just stable on my methadone and that, but because I've used drugs a lot in the past, you know, when I speak to doctors, I think they think I'm lying sometimes. Does that make any sense to you?
Lying about what?
About the way I feel and that. I don't know, it's just the way I am.
Do you mean specifically about people might think you're not depressed?
Yeah, that's what I mean more than anything, yeah. But
it's not our job to cast judgment or really make those kind of assertions. I have to take what all my patients, regardless of their background, what they tell me, I take at face value.
No, I understand that.
You do have a mental health problem.
Yeah.
Lifestyle change is not easy for a patient to do, and nowadays a lot of people just want a tablet, they want medication, they want sort of recovery to be something passive, but unfortunately it's just not an option. So I think it's really important to give patients time, find out, you know, what they understand about the situation and make sure there's some kind of plan for them to come back and talk to you about it.
When I last spoke to you, you didn't think that you would ever do anything. I mean, we spoke about suicide and quite some dark things as well.
Yeah.
Are those thoughts that is still not the sort of thing you'd act on, or?
No, I'm not brave enough to do it, if that makes any sense to you.
Are there any other protective factors that you think, other things that stop you? Does your mum or your son come into your thoughts at all?
Only family, really, now, yeah.
Mm-hmm.
Do you know what I mean?
I'm glad you don't have the courage to do anything.
Yeah.
But if that ever changes, if you suddenly start thinking you're so low that you think you are going to act on those thoughts, it's vital you come and talk to us. Okay? And if you can't get in touch with us, you need to pick up the phone and talk to Mind. They've got a good helpline, or the Samaritans have got a helpline. If that's not working, you have to go to A&E because they've got trained psych liaison nurses who are there for that sort of discussion.
I know that, yeah.
And I started you on some tablets as well. Do you take them every day?
I do, yeah.
Okay.
But I haven't taken them for the last 4 or 5 days because I ran out.
It is really important with these kinds of medication that you build up slowly and you don't suddenly stop.
Yeah.
Well, a big part of it is being a bit organised about your medication. Because sometimes when you're feeling low, you lose the motivation to stay organised. But actually, when you're feeling low, you need to be more on it. When do I run out of tablets?
Yeah.
When do I see the GP next?
Yeah.
So I'll give you some more of your medication. To be honest with you, you've only been out of jail for a couple of months, and from my point of view, whenever I see you, I think you're doing pretty well for yourself. And staying out of the drugs and the alcohol, which got you in that situation in the first place, is the main priority.
All right, thank you very much, Doctor.
Take care.
Okay, have a nice day. Thank you.
Bye-bye.
Morning, hello.
How you doing?
Okay, thank you. How are you?
Not bad.
Why am I poking your belly?
Well done. Oh, well done.
Right, make sure I've got the right person. Give me your name.
Leslie, James
Yeah, have to
Bernard.
check.
Yes. Left arm or right arm?
Which, now, you're the one that keeps telling me you've got fabulous veins, right? So let's have a look at this one.
Yeah, no, listen, I've done this one, but yeah, it's mostly that one.
Well, let's see, because this is nearest.
Okay, here we go.
Anyway, have you starved yourself? You've not eaten?
I had about 12 o'clock yesterday afternoon.
That's all right. But not this morning, because these are
No.
fasting bloods, all right? Let me try that one. How's your mum?
She's fine.
Do you live with your mum?
Yeah.
Yeah, I thought you did. So you've got lovely veins.
Ooh.
Right, put your hand on there.
I'm a brave boy.
You are. You deserve a lollipop for that. Now, listen, these go off today.
Yes.
And the results will be back for Tuesday.
Okay.
Right. Let's just put a bit of tape on you. Go and eat something decent for breakfast. There you go, you're done. All right?
Look at that. Good old arm.
OK, take care.
Thank you very much.
You're welcome, bye.
Have a nice weekend.
And you too.
So the swelling itself only started yesterday. And have you had lots of discharge?
Yeah, I've been bathing with salt water every few hours.
OK, so if you want to go ahead and use that to... Yeah, that's it. Perfect. And is it painful?
Yeah, the upper eyelid is very painful.
Okay. I'm just going to hold your eyelid up a little bit.
That's painful.
That's
When that comes
painful.
in, yeah.
Now, does it hurt when you move your eye about? I can't see very well.
I'll try again.
Can you see my finger?
I can.
Keep your head still and just follow with your eyes.
I don't think I can do that.
That's painful. Yeah, OK, you've had no insect bites or anything up there, but you have been unwell with sort of cough and cold symptoms. OK. The sinuses, there's one here called the ethmoid sinus, which is very close to the eye. And sometimes it's possible for infection to spread through. My worry would be, because I can't get the eye open very well and because I can't assess the eye movements, if there is any infection around the eye, if that tracks into the muscles that are close to the eye, we could be in trouble. I think we're going to have to get you over to St Thomas's.
When?
Today.
You're not joking.
No.
I can't do that.
Yes, you can. Why can't you? You're already off.
There is Moorfields.
No.
No, that's a bit of a way away.
No.
This is not a negotiation.
Oh my gosh.
Present this to reception when you get there. So, good luck.
Thank you very, very much.
Hopefully it will be just very straightforward and they can send you on your way and everyone will live happily ever after.
Thank you.
Excellent.
Thanks a lot. All right. Have a good one.
You too. Oh, thank you.
I haven't got any appointments that have been cancelled today. You'd have to give us a ring at 8 o'clock tomorrow morning for the same day appointment. No, you need to phone in at 8 on the date you want the appointment. OK then? Thanks, bye.
Hello. Come and have a seat. Natalie.
Yeah.
How are you?
Well, I've come back, so I'm still getting this real tightness in my chest at night. I feel like somebody's wrapped a belt around my chest and is pulling it really tightly.
On the front bit of your chest?
Yeah, sort of right here.
On that left?
Yeah. I will find that I sort of have to sort of stop to sort of take a breath
Is it
in.
that you feel you can't get enough air in?
Yeah, that's how it sort of feels. But then when I lie down at night, I get this sort of quite severe sort of chest pain.
When you lie down?
Yeah, it's when I'm lying down.
We doctors always think of the worst things first.
Yeah.
Your pain doesn't sound to me like anything to do with the heart. So we then think about what might be going on in the lungs.
Mm-hmm.
And you've got a normal chest x-ray.
Mm-hmm.
So, you know, I'm thinking, is there something else going on in the lungs?
Yeah.
You would have to speak to the duty doctor regarding that because it's a medical question.
You need to run tests on him because his immune system is amazing. He had exactly what we all had and he's better.
Sorry to burst your bubble, mate. It's not your amazing immune system.
If I press on any of these bones, do any of these hurt? Going down here. Am I producing the pain you get in that side of the chest?
Yes, yeah, you are. I can feel it sort of...
Coming across there?
Yeah.
But I'm not actually hurting, so
No.
coming down...
Yeah, that's...
Sorry.
It's right there.
And that is the pain you're getting going right across the chest? Yeah. OK. Let's turn around and listen around the back. Take a really big breath in and out. Does that hurt?
Yeah.
Sorry. And where it hurts is there?
It hurts like
Round here.
Coming round underneath my breast.
OK, let's come and sit down. And you've had this a long time?
Quite a while now.
Wow. I think some of the problem is a condition which I'm going to give a funny name to, called Tits's disease. Right? There's a joint between the end of the ribs and the breastbone. And for some reason, there is something becomes inflamed, that particular joint.
OK.
And Titsy's just the name of the guy who discovered it.
OK. Is there anything I can do about it?
Well, they do say take anti-inflammatory pain relievers. Sometimes physiotherapy can help a bit. So I don't think it's the end of the world. I'm sure we can probably help.
Thank you so much for being so thorough.
That stretches my diagnostic skills, but I think I've got the right diagnosis.
I wanted to do the poo sample and check there wasn't a bacteria in your stomach.
Everything feels normal when you're wiping your bum and... Yeah, OK.
You don't pass jet black sticky poo.
Yeah, maybe.
He's done a poo, hasn't he?
How can I help you today?
My mum just found out recently she's got cancer and that. So I just want to get myself checked out basically to just make sure that everything's okay, really. Yeah.
Tell me what happened with your mum, what she been diagnosed with.
She went for a checkup and I just colon checked and stuff and they said that she had cancer spreading from her kidney to her lung.
Quite tough then.
I just want to get myself sorted, just checked, just to see if I'm okay, really.
Are you worried that you might have cancer then, or...?
Yeah, because her mother died from cancer as well, so I'm thinking it might be hereditary, so...
How have you been in yourself?
I've had slight murmurs, like when your heart feels like it's Mr. B or something. It's like like I've been running but I haven't.
Do you get other symptoms?
I've been passing urine quite frequently as well.
Because of those symptoms, with peeing more frequently, I just need to ask you a few more sensitive questions.
Okay.
When was the last time that you had sex?
I'd say a month ago, 3 to 4 weeks.
Was it with a regular partner?
Yeah, I would say so.
Have you had sex with anyone else?
2 people besides this girl, but they're all regular.
So you're having sex with 3 different...
Yeah, basically.
Do you get any discharge from your penis at all?
No, I don't think I've contracted anything like that.
What we can do is listen to your heart and lungs and take a look at your stomach. So sit up for me, sit up. Deep breath in that. And out. Okay, and in. Okay, your chest and heart sound fine. I'll get you just to lie back for me and I'll take a look at your stomach. So just gently press. Yeah. So it's not painful at all. Okay, your stomach feels okay. And what I'd say is examining you, to me, everything is normal to examine. Okay. So that's reassuring.
Yeah.
I mean, you're telling me that you're sleeping with 3 different girls at the moment. That puts you at higher risk of having sexually transmitted diseases. So you need to make sure you're practicing safe sex, so using condom.
Yeah, definitely.
But you are at high risk of the fact you're having 3 different partners.
So
I could get you to do a urine sample to test for chlamydia and gonorrhea. Have you got details for the sexual health clinic as well?
No, I haven't. So if you've got a number, I'll be very
Yeah, I can give you
helpful.
details if you want to have a full check.
Yeah, thanks very much for that.
Right, no problem.
Come in. Hello. Come in. How are you today?
I think Bailey might have chicken pox. He's come up in the little spots, so I just wanted to check to make sure.
Has he been in contact with anybody with chicken pox?
His little cousin has it.
So when was he in contact with it? Week, 10 days ago?
Very recent.
Yeah.
Very recent.
Should we have a look? Oh, yes, we've got some spots on his back coming out. Here. Can you see? They're coming out in little bumps, in blisters first. Then they usually become a sort of yellowy pussy for a little while, and then they come scabby. So have you got any on your head? Let's have a look.
A little bump there, I can see.
Possibly, and possibly a little one there, isn't there? Yeah. Shall we have a look in your mouth now? Hasn't actually got anything in his mouth yet. He's got a wee bit of a temperature. 37.7. Right, the normal is 37.5 and below, so it's just a fraction above normal. I think it probably is going to be chicken pox, to be honest. He's actually infectious 6 days from when the rash comes out. Now, the spots won't have gone by the end of that 6 days, but they will be scabbed over and his temperature will be down. But, you know, he needs to be off school, I'm afraid.
Yeah, that's fine.
Is that all right?
That's fine.
It's a good thing to get it over with, you know. Well, there we are. Champion.
Thank you for your help.
Good, bye.
Bye.
God bless you, Doctor.
Take care.
Thank you very much.
Oh, thank you. Bye-bye.
Bye-bye.
What a good doctor you are.
Take care. Lovely to meet you.
Thank you very much.
Go away. Behave yourself. Take care. Bye-bye.
Thanks for your help. No problem. All the best. Take care.
All right.
Take care, God bless you.
Take care too. See you again. Bye-bye.
I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe. Does it look irritated?
No.
Honestly, not at all.
Not really, no.
So you're going to get reception to call an ambulance, all right?
I was wondering if it might be possible to have a little wee for me.
So little.
I know.
That's too little.
I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Okay, here we go. Take a seat for me. Right, I think you spoke to my colleague Dr. Sayer earlier on today and saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay, is this something you've had before?
I used to have really bad depression, like from when I was 17. I got diagnosed with it, but lately it's just coming back. Like I don't want to leave the bed. I can't eat. I'm not.
So nothing's changed in life or nothing new. It's just
literally I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't. Like, earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
Well, like, I might need a few days just to gather myself. And it's something that's documented that I've struggled with for years.
Yeah.
But right now I'm scared that it's only going to get worse.
Okay, all right.
When I was younger, I would literally lock myself in the bathroom and they would have to call, like, the police and stuff to come and get me out. And I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well look, most people have started on either sertraline or citalopram.
That's the only one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you, though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those?
Yeah.
Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder because propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay, like you did today. If things don't improve, just give me a call.
Perfect, thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
My asthma's been quite bad recently.
Could barely breathe, just really tight chest.
And then, all of a sudden, I start to cough. I was short of breath.
I felt like my whole chest was like a balloon that I just had too much air in. I couldn't get it out.
So it just like instantly I'm just like, I can't breathe.
So your asthma is not good.
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. Yeah. How long have you been like this for?
It was bad last week, and it felt a bit better, and then probably I think Friday last week it felt not so good. And
How many puffs have you had today?
About 6.
Okay, I'm going to get you a nebulizer now so that we can talk a bit more, okay? I might need to come and sit here, Mum, just so you're next to the... I can plug this in. When ready, I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for? Today and is today? I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. We're going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
Severe asthma attack.
She's got respiratory rate of 60, despite a nebulizer tell them, so they need to come in now. If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly.
Tony speaking, how can I help?
What's your date of birth, please?
Vicky speaking, how can I help?
She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again from what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days, despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebulizer. She's still got a respiratory rate of 60. All right, I hope it gets better soon. Okay. Thanks, guys.
No.
Thank you. All right, thank you, guys. Good luck. Take care. Poor Lord, she's just breathing. She's terrible. So fast. Really frightens me when they're that bad, because, anyway, poor love. Relief in one sense, when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability, and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late, because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.
Hi, how can I help? I've just been waiting a while now. Didn't know if you've got me.
Yeah. So, because there was a medical emergency a while ago.
Yeah,
you'll
you're
be
line.
next. She just seen someone else. Sorry about the delay.
Don't worry.
Thank you so much. Bye. I can't decide if my headset's playing up or I'm speaking to a lot of deaf people today.
What do you think it is?
I think it's the headset. But then I speak to somebody else and
it's
everything's
fine.
fine.
Yes, one of them ones, please. Do you like stickers?
Yeah.
Do you think you'd like a sticker?
I would like a sticker.
Oh,
Yeah.
a sticker? Yeah, you can have a sticker for you. Even though you didn't have an injection, which one would you like?
Now, would you like a sticker?
No.
No? That usually works.
Come in. Sorry? Oh yeah, of course you can have a sticker. Look, I've got flowers, butterflies, cars, dinosaurs. A dinosaur one, I think that's a great choice. There you go. Can I have a high five? Very good.
Right. Are you going to tell us what's the problem, or are we going to leave it to your dad?
I don't know what the problem is. Mummy, I know what the problem is. So when I was at school and the door was open and it got really cold, then I was cold, so I put my jumper on, but that didn't work.
Oh, okay.
But everybody else was in t-shirt, weren't they?
Yeah.
So you were feeling cold, were you? Because I mean, it's been sunny the last few days, hasn't it? So, do you feel any pain or soreness or?
I'm okay.
You're okay. You're fine. Can I get your dad's take on things?
Yes.
See what he reckons.
Obviously, they saw him putting on the coat when everybody else was sweating. So they took his temperature and he was very hot.
Okay.
They gave him some medicine, but as soon as the medicine wore off, he spiked again.
Yep. I was wondering if it might be possible to have a little wee for me. Let me give you a pop.
That's so little.
I know.
That's too little.
It's practice, isn't it? I'll set you that task if I may. Any success?
We have.
Oh, look at that. What I do is I just dip my little bit of paper. It's quite clever stuff, really.
Is that easy, isn't it, Dad?
Yeah.
It's easy being a doctor. Okay, there's no urine infection.
Okay.
I think where it's coming from, it's a viral infection of the upper respiratory tract, and there's a tiniest little bit of redness in the ear at the back of the throat, and he's got a few lymph nodes up there. It's almost certainly going to settle down on its own.
Okay.
So it's just a question of keeping an eye on him over the weekend. So keep him well hydrated. Calpol's absolutely fine. These kind of things usually take between about 5 and 7 days to settle down completely.
Cheers, thank you.
Have you got any questions for me?
Have you got any stickers?
Right, what are you going to have?
Bye, Dad.
Okay, cheers, thank you very much.
Nice to see you, babe.
Thank you.
Take care.
Thanks a lot. Cheers.
Pleasure.
Bye.
Bye, take care.
That was easy, wasn't it, Sam? That was easy.
Yes, well, it wasn't a test. He's just trying to make sure that you're okay.
Yeah.
Does it sound any different if I talk to you on this?
I can't hear at all.
Ah. And you can hear me okay on this one?
Yeah.
Okay, thank you.
You're welcome. And Tony speaking, how can I help?
Hello, Miss Morrie. Hi. How are you?
I'm not too bad now.
Okay.
If I have something to eat and then I have to go and pass a stall,
yeah,
the pain that I get, it's like you're open, but you're not closing up. I don't know, like it hurts a bit.
But no bleeding from the back passage or anything like that?
No. It can happen, but that's very, very rare.
Okay.
That's just rare, that is.
And we spoke last week, obviously, about alcohol as well.
Oh, yes.
And that's still something you're taking daily?
Not daily, but every other day or every 3 days. Yeah, I do. And my roll-up cigarettes.
Yeah.
You know. Personally, Doctor, I can't see that changing, really. The only other thing I can say is my diet is very, very poor.
Yeah.
Because I do not stick to a proper diet. I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Yeah.
I don't want anything else. I have no desire for it.
And you said last week, there wasn't any problems with any food sticking or anything like that?
No.
No problems with swallowing?
No.
And obviously you haven't got a huge amount of weight on you?
No.
But you hadn't lost any weight or anything like that?
No, not to my knowledge. No.
Not to your knowledge. Given the fact that you smoke a fair bit and drink a few times a week, we know that there's an increased risk of things going on in the stomach. And that includes things like stomach cancers. Okay.
Yeah, I've thought about that.
Yeah.
It won't hit me like a ton of bricks if I find out something like that. I've had a good innings.
Yeah. But I think we should investigate that a little bit further. Even without those blood results to look at, I think we should be referring through to the hospital for somebody to pop a scope into the stomach to have a look. What do you think about that?
Yes, but why not?
Because we've talked about things like stomach cancer, it's something that the NHS really does investigate very quickly and very comprehensively. Do you think that's something that we should refer you for?
Yes, I think so, Doctor.
Yeah. I think that's important.
Okay, then.
How's it going?
Kim, Erin and I were saying you've been so... You look like you two were kissing, then you turned around. Erin, like, she called
Hi. Oh, careful. Sorry you had to walk a bit further down. How do you think I feel?
Oh.
Been a while since I've seen you, hasn't it?
Yeah.
Lucky you.
I know. Let's hope I'm going to be bloody lucky now.
Have you missed me?
Oh, yeah. Well, I miss you, but not coming around here.
Can we do your left arm? Because I know from previous...
I know.
I think I know your arm better than you do.
You don't. Oh, that went in nice.
Didn't even feel it, did you?
No, I didn't. See, that's why I like you.
That the only reason?
No, I like you as a
I was going to
person, I
say.
do. And as soon as you got
Just
that colour...
using me for my blood technique.
Definitely.
You like my hair colour then, he said?
Yes, I do. I used to be that colour when I was young. A natural colour, though, it was, until I...
Have you ever seen my natural hair colour?
No. Black.
Mm-mm.
Brown.
Ginger.
Ginger? Not a bit of an Irishman, are you? Any holidays yet?
Yeah, I'm going away in 2 weeks. Where do you think?
Turkey.
There you go. You know me so well. GP surgeries do become like an extended family for elderly people because they do come in a lot more than some younger people. So they do get to see like me, a healthcare assistant, a doctor and a nurse. So, and they have different relationships with all of us. So that is like a family in itself. So I'm probably like the little naughty grandson, and then one of the nurses could be this. You know, that's how they see it. And it's like a day trip for some of them as well. They get a bus in together, some of them. So yeah, it's quite sweet.
Well, my niece got married, not last week, the week before, in Spain. So I've got another one getting married in Spain next year.
Are you going?
No, I never went to this one. I said, I won't be able to come to that. We'll get you a wheelchair at the airport. He said, we'll get you there. But
I need a wheelchair at the airport as well.
I need a wheel. I need everything at the bleeding airport.
By the time I'm done on the plane, I need one.
Taxi there and taxi back and
Oh,
comfort.
lady of leisure.
Definitely.
Look at you.
Well, you know why I say I might as well spend it because they'll spend it when I'm gone. Nice seeing you.
Oh, you too. Always lovely to see you. Take care.
Will do.
You got a paper?
Yeah.
I want that crossword finished by the time I come out there.
Yes, take it home with me.
Thief.
Bye-bye.
See ya. Even from when I was on reception, I always thought, try and make somebody leave here happy because you never know what they're going in to see the doctor for. It could be anything from bereavement to cancer. So making somebody's time here happy, I've always thought is very important.
Erin speaking, how can I help?
Right, have a seat. What can I do to help?
I had some fertility tests last year and I got given the results. It was when I was with my ex-girlfriend. I went to a specialist and he explained that I was kind of slightly below average but in normal parameters. But then when she went back, there's another doctor that she spoke to who said, no, the specialist is wrong. You need to get a second opinion. And they said, yeah, those results are on your record, so you could explain them to me.
Right. So we're wondering if you do or don't have a problem with your sperm.
We are, yeah.
OK. I've got a set of sperm results from the 1st of May.
I mean, looking at some of those numbers to me, obviously it looks devastating when you look at the low figures.
There are two numbers which are not as high as we want them to be. The first is the number of sperm which are swimming in the right direction. And what you want is more than 32% of sperm to be swimming in the right direction. And only 21% of yours are.
Right.
The other thing which is not ideal is this number of normal forms. What that means is they look down the microscope at the sperm and see if they're the right shape.
Yeah.
They didn't see any of yours which were the right shape. So I guess we've got a couple of choices. I think there is a lot of variation in these samples, so you could do a third test. Another option is for me to contact a urologist, give them all the numbers and say, what's the situation? This is one interpretation. What does this actually mean?
Okay. Well, that's definitely the first step for me. And can he give me more of a breakdown as opposed to just a, you know, I don't know, just sort of more of an explanation, because I still don't really understand that.
What would, in an ideal world, what would you want them to be able to say?
I want to say you've got this percentage chance.
Of having a kid?
Yeah.
Okay.
I think anyone in their right mind would want to know.
Yeah.
I want to have an idea.
Yes, I understand where you're coming from.
You've been in hospital, you had your tonsils taken out first of all.
One.
One, the right side, yes.
The right side, and I'm too beg your pardon, sorry.
That's okay.
It's been in constant pain ever since, and then about 3 or 4 days later, I just cleared my throat and an enormous volume of blood suddenly appeared.
Oh my goodness, okay.
So I had to call the 999, taken back to the hospital.
Thank you, Bridget. Okay.
Initially I was scared it might be an internal, but it wasn't. The bleeding was actually
From there?
From there.
Okay. So you've got here, you're seeing the Royal Marsden Hospital this Thursday, okay.
He's going to have, I think it's 20-something, lots of radiation.
Yeah.
And then the second for 5 days a week for 6 weeks.
Okay. Yeah.
And he's also going to have chemotherapy.
That's a lot.
Just a damn sore throat, that's the known bit.
Okay, so it's the pain that's the biggest issue for you at the moment.
It can't be, especially at night time.
You're on the omeprazole, the propranolol,
yes.
The calcium and the vitamin D, and then the bone alendronic acid once a week. And then importantly, painkiller-wise, is the cocodamol. If it's difficult swallowing tablets, do you want to keep it as a tablet form?
I prefer, I had a choice of that or up my bum.
Oh, John.
I did. So I quickly learned how to swallow.
As an alternative, a third option, you could have dissolvable tablets or liquid.
No, I'll stick with the tablets.
The tablets, you're okay swallowing
absolutely.
them? You can make them a little bit stronger if you want.
Just slightly stronger.
Slightly stronger, yeah.
But again, just for the occasional rise.
Just for the occasional, yeah.
Absolutely, no other reason.
What else do you need to...
No. Yeah. My sister, one of my sisters, she's critically ill in Ireland.
You told me on the phone, yeah.
Charles is my first priority, obviously. I can't leave him at all, and I wouldn't. But I need to go over to Ireland if I can. If Charles's sister came and stayed, which she will, all the time in the house with Charles while I'm away, do you think that is...
I think that's fine.
It is.
I think that's absolutely fine, completely. Yeah. If Charles was happy with
absolutely.
it.
Yeah. Absolutely.
And you have...
Absolutely,
yeah.
Of course.
It would only be for 2 days.
Okay. You know, your sister, she's very unwell, she sounds... And you need to...
Yeah.
You need to go over, and if you've got somebody... Not that Charles you need looking after, but I think it's nice to have somebody else there. You've had a very difficult time and you're going through a lot, and if your sister can come and help...
patient.
You're not a difficult patient. You're not at all. We would like to support carers as much as is possible. It's often a very unrecognised role across the UK. They estimate 6.5 million people are carers in some form or another to friends or family, which works out at 1.1 in every 8 adults in the UK. So it's a huge proportion of people. Often people might not recognise themselves that they are carers. They may be providing a caring role but not think of themselves as a carer. So one of our roles is to try and identify people who are providing a caring role and try and support them as much as we can. I think you're coping, from what I can tell, very well. And
oh,
I know
good Lord, I've got a lot to do yet. Right, but we won't take a little longer.
Okay, no, not at all.
Time.
Perhaps we could see you again maybe in about 2 or 3 weeks.
Oh,
great. We could do that.
Yeah,
and then,
that's very kind.
But anything in the meantime, I'm happy to speak on the phone. Not at all.
Very, very much indeed.
No, okay. All right, bless you. Oh. Okay.
Thank you.
All right.
Thank you for all your kindness.
You're very welcome.
Take care. See you soon.
Take care. So, okay. Bye-bye. All right.
Vicky, I'm going to win the lottery, okay? I just thought I'd tell you.
Just in case you do, I just want to let you know how much I like you.
Who are you?
If you feel you need to be seen, I can arrange for an on-call doctor to call you. If they need to see you, they will arrange a time for you to come in. Perfect.
To practice.
Yeah, practice it in front of the mirror.
Hello.
Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This time last year I was flying away to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. He had to have 5 units of blood.
How are you?
I'm all right, I'm in bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, the sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath, and he just went. His eyes and his
Roll
true
backwards.
And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me. I'm out, but I just thought, what am I going to do? But anyway, I know, but I'll be all right, I have to be.
I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a Carers Association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling, and I think that's an important outlet for her.
I can't fix my hair up.
Brush it.
I have.
No, you haven't, Pa. Brush it properly.
Watch.
That's not brushing it. It's not even black. How are you not? This is brushing.
Yeah, but ow!
You have to brush it. It's called brushing.
Don't. You're hurting my scalp.
Oh, shut up. See, that's what it's called
Yeah,
brushing.
but I don't want it flat like that.
It looks nice. It was sticking up before, like the Mad Professor. You look like the Nutty Professor.
You are the Nutty Professor.
It looks nice now.
Yeah!
Mr. Morey, hi.
Hello, Doctor.
Hi, come in.
Thank you.
Come in, take a seat. Okay. And Miss Morey, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always the possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. and now I'm 59.
Okay.
And I thought there was something in this.
Yeah, this type of cancer in your stomach isn't one that typically is very aggressive or anything
But
like
it
that.
is a cancer.
It is a type of cancer, yes.
Ah, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay? Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from... Let me show you the letter from the hospital.
Yeah.
So...
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
You take your time. Do you want a glass of water or anything?
I'll have a glass of water, please.
Let me get you a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There we go.
Thank you, Doctor.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor, because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today.
Yeah.
And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh, no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things, and I've got over everything. But I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing. And there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said,
Yeah.
the big C,
Yeah.
to quote, how long would it take to happen for me to,
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So this type
because
of
I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that it very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now, I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh, yeah. Huh. Make no mistake.
It's Murray. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, you know, if you've got any more
Today?
questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor.
Okay.
If anything happens to me, in the meantime, or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's, you know, the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Len.
Okay.
Thank you very much for your time and your concern.
No, not a problem at all,
appreciate
Mr. Murray. You know, these are the most important times.
Thank
and
you,
that's
Dr.
why
Len.
that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then. Shit. Shit. Hi, Dr. Barker. It's William Laird. I've spoken to him about the results. He was quite distressed, so I'm quite a little bit on edge at the moment. But I hope he will come and see me at 1 o'clock. You know, but then I'll panic a little bit if he doesn't. maybe I'll pop round the corner to see if he's at home. Yeah. Pleasure to talk to you once again. Thank you. Bye then. Bye. I think breaking bad news it's always a complex thing, whether or not you've known the patient for a matter of days or hours or months and years. It's just unpredictable how you're going to respond to this and how they're going to respond. And it's really just trying to provide information and let them know that you're there for them at their time of need.
I didn't win the lottery.
Oh. I still like you though.
Hi. Yeah, I'm not going into the I'm not going to go to the meeting.
Okay.
If my patient comes in, will you just let me know?
Okay.
He said he might come. He said he'd come back at 1 o'clock.
Which patient's this?
Mr. Murray.
Okay.
So,
Okay.
let me know when he gets here if he does.
Hello,
Hi.
Hannah. Come and have a
Thank
seat.
you.
How are you? What's happened?
I don't know, my eye, and I think I might have been a bit overdramatic coming straight to you, but one of my eyes, it just started, like, it felt like there was something in it, and I've spent ages putting my finger in it, which obviously hasn't helped, and then I thought it seemed like there was something in it, but it looks like, I don't know, you look at it and you tell me.
Right.
It felt like there was maybe some, like, fluid it was been really watery, but then it seemed like there was some creamy coloured.
Discharge.
Yeah, but not much.
Okay.
And then that bit there seemed really red, but I have poked it a lot because it was. I mean, it was just literally my eye was just watering because it just feels like there's something stuck in it.
Okay.
How does it look?
Looks okay. I'll have a look in more detail though.
Okay.
I'm just going to pull your eyelids down a little bit. Look up for me, and look left, and look right, and follow my finger with your eye. Okay, come and have a seat for me. So...
There's nothing wrong with it, is there?
Well, I can't see anything there.
Oh, okay.
I guess you've got this sensation of your eye being irritated and
Yeah.
sore.
Does it look irritated?
No,
Honestly, not at all.
not really, no.
Oh, I've spent all morning looking at it. It feels like something here is like rubbing every time I'm moving my eye around, but obviously not enough for me to not want to move it. Do you know what I mean?
I do. I mean, if we were going to completely exclude a foreign body having scratched the front of your eye, I guess we would need to stain your eye with fluorescein and look at it under a blue light.
Yeah, that seems a bit much considering I feel like I've never rubbed, there was never an opportunity for something to actually go in it.
No,
Okay.
I agree. It feels like a bit much.
It does feel like a bit much.
Because your eye essentially looks completely fine.
Yeah.
Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger because every time I seemed to drink that, I would get a headache afterwards.
Can you put your hands behind your back as though you're doing your bra?
I can't put my bra that way. That gun, will it increase my CO2 emission?
No.
I buy some, what they call Dr. Chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot.
It's making me anxious. I'm a nervous wreck. I just can't stay there.
Why not?
I feel vulnerable. The house has been broken into before.
Right, okay.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer because it really hurt.
I mean, that's the most terrible bruising I've ever seen.
Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising.
Good morning, Nana speaking. How can I help?
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle. It turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It really just doesn't feel like it's getting better.
Unfortunately, so the thing is, like, the laryngitis is typically more with the loss of voice. It tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route or anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, It's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice? Or...
Going to Lisbon for a hen weekend.
Okay. Yeah. Hen weekend like this. No.
I organised it, otherwise I wouldn't go.
Not the best combination, unfortunately. Stand up and let's have a listen. Let's have a listen on your back. If you, is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from last time? Where it was sort of...
I just had a sore tooth, but by the time I got there, it turned into like a wisdom tooth. And I just spent the whole nothing was open because it was Easter.
Yeah.
And I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this Henry Can.
Can you say limiting?
Well,
realistically.
do as you feel is right.
Okay. Is there anything else I can do?
Things, you know, sort of sometimes, you know, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It's just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time. It's really the key.
With the flu that I've had.
Probably just incidental. Your immune system was probably knocked with the flu, and then you've developed this infection.
All right, thank you
So,
very much.
yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, sort of a standard set of signs and go from there. Take care. Take care. Bye then.
What's your date of birth, please? Oh, happy birthday! Come and have a seat. I'm Dr. Beecroft. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
Just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. Okay. I was just like, and I've tried everything that I can possibly get just over the counter. Yep. But nothing just seems to work anymore, and I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision and makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah, blah, blah. And it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them.
Yeah.
Out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. Let's hope it helps.
Yeah, thank you so much.
Okay. All right, have a good
Thank
day.
you.
Bye.
You too. Bye.
So come in tomorrow at 12 and then I'll help you with your registration, okay?
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
So tell me what happened. Well, I was on a mountain bike and I fell sideways, put my hand out, and I still can't really bend it.
I slipped backwards as I was getting in the shower, elbows down, and smashed the decorative tiles.
Just bend it this way?
I don't think it's like broken, I think it's just like really sore, I guess, and then my head hurts a little bit.
And it wasn't that anything felt like it popped out or popped
No,
back
no
again?
popping. It was definitely a rip of some description.
Okay.
Hello, good afternoon. And come in, take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine then?
Yeah, I'm using it. Like,
and you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in that, in and around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. All I know I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here, around the elbow? No. Okay. So I'm happy with everything bone-wise in here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin, it's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here, has just ended up around here. And
Okay.
the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just get it
What's
checked
it
out.
getting up to?
Yeah.
Exactly. Well, you can be relaxed.
Cheers.
Okay, take care, have a good evening.
I mean, that's the most terrible bruising I've ever seen.
And no other reason?
No. I don't remember.
No falling,
I mean,
no
I
injury, no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So
Yeah,
if
you
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it. to cause this.
But that's the shoulder, but this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly.
Yes.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis?
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need 2. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
sun.
no more trips to
and a
Ibiza.
hat. No more trips to Ibiza.
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Sharp.
Thank you very much indeed.
Bye-bye. See you.
My belly's just bloating. Should I just stop eating wheat? No, I'm gonna bring in my what's that tea?
Green tea.
Yeah.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle. Like, go to the gym like 4 times a week, eat really healthily. Like, I don't eat any overly like refined carbohydrates or anything like that. Super healthy. However, in the past month, recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant. Okay. Every single time, even if I'm only having like a bowl of soup, just blows straight up and it feels really tender. Okay. And it's getting to the point it's just so uncomfortable. And at night, like, I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. So, okay, accidentally had pasta last week. And literally I was sat there at work and I just couldn't do anything. You know when you're just all cramped up? It just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too
No,
soft?
like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I
without
think my
trying?
weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Does anything run in the family at all? Any bowel problems, celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there?
Yeah.
Okay. And here?
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
So I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer.
Oh,
because it really hurt.
I think your symptoms, a little bit like irritable bowel, what you're
Yeah.
describing. Often people with irritable bowel tend to have some sort of bowel upset, so
Yeah.
either diarrhea or constipation. You don't tend to have that.
No, no.
So it's more kind of just the bloating and
Yeah.
things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I
and
said,
sometimes
so-
it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's
but it's,
exactly what I was confused.
You know,
So
things that can cause bloating are apples and pears and artichokes and beetroot.
absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect. Thank you so much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
Start
tend
looking
to
like
be
5 months pregnant everywhere I go because I'm so little as well. It just looks absolutely ridiculous.
Okay.
That's great. Thank you
All
so
right.
much.
Pleasure.
Thank you.
Okay.
Hello, could you please give the surgery a call regarding your appointment this evening and speak to reception?
I don't speak to
I'm fine. What
Shouldn't be asking that, should I? You should be asking me.
What can I do for you?
I'm actually need a favour. I've recently swapped into a ground floor flat.
Yeah.
And I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards. I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Why not?
I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it's obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local councillor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
So my next appointment with the doctor is Friday. Do you feel able to wait till then?
OK, so I've booked you in 4:30 with Dr. Laird.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides, it just depends. I don't know. They just come and go. I can eat a horse and feel all right. I can eat half an horse.
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here. I will go through it. So, then I'm sort of like
having a good yawn.
I'm having a very good yawn. Like, I'm making up for like the last 4 in one go.
Okay.
You know, with the last 4 average yawns, I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good.
I'm not a big meat eater. If I've left to my own devices, I would tend to eat a lot of beanie type things.
Okay. I tried a very tentative with egg.
Yeah.
And she had a rash, but mainly around her mouth, and she also would vomit.
I don't eat any butter at all, apart from on toast, which is about once a week. I do eat cheese, but not tons of it. I stopped eating bacon because of this.
Do you like your milk more than your food at the moment, young man? Is that the problem?
So you thought you had put on weight, so you stopped eating potatoes.
Yeah, and just stopped eating a lot of potatoes and stodge was not the thing to do. You know?
Oh, right, okay.
But I possibly went too far down that road.
And we'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods. You know,
It's mostly
or even
cereal.
microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call not chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, like I mean if it was like 30 gobstoppers.
When you've eaten 30 of these things. When you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. You know, so I don't eat a lot. Oh, I drink now and again. Eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans and then
yeah,
drink.
the cans are ongoing, right? But the thing is, going out recession is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day,
no,
15 pints?
I'd go more than 10, but I wouldn't say... I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
The lungs seem to be working, don't they?
Hiya, I've just lost Lily. I think she might have gone to the toilet.
Oh, okay.
So she said, fine. I haven't looked because she's just been taking her weight and all things, preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Oh, well done.
I broke my leg. No, that's
Right.
Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, okay? Let's bring you back down a little bit.
She's a very active little girl.
Okay, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a series. Like, there's more of them.
Can I have a little look in your nose? Is that okay? Yeah? So, what's the longest without a nosebleed? A few weeks? A month, maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is, I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80. Just relax your nose. Don't scrunch it. Relax.
Is it gonna hurt?
No, it's not gonna hurt. I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating. What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, OK? 4 times a day for 10 days. 10 days? Hopefully that will stop the nosebleeds.
Be sad. 94649.
Wow. We're happy. All right, there we go.
Lila,
Okay.
you've got to stop. You've got to stop now.
All right.
Thank you very much.
Bye-bye. If you feel he needs to be seen, I can ask the on-call doctor to call you.
No, you're full of stress.
Wouldn't you be stressed? Can you put yourself in my situation?
I know. I know.
Instead of ganging up on me?
We don't gang up on you.
You did.
We just want to help you.
Even
Take
Chelsea brought.
Take the stress off.
Come in.
Pleased to meet you, mate.
Hello. Please do
Hello.
all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take it away, can you?
You can't. What can we do for you
Well,
today?
what happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after half an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good, lost a bit of weight, looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, but he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor
That's right.
to have another examination.
That's right.
There we are. Well, we can sort
Slot in
that
around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know, can they cure floaters?
No.
Kind of thing now, instead of turning my head suddenly, I might get a little arc, like flash, but I've got a floater there now, but I'm kind of learning how to put up with this.
Yes.
Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment.
What I'd like you to do is, on the way out, if you hand this to reception so they can photocopy it,
That's fine.
and I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, and thank you very much.
I don't know what's causing it, but essentially my mouth is very sweet.
Very sweet.
Yeah, it tastes like I've always got sugar in my mouth.
I have to say it's a completely new one for me. I've never heard anyone say that before.
I couldn't feel anything here and here. It's like when I had anaesthetic.
Did you have swelling on your tongue as well, or just the mouth?
Not the tongue, just the
And
mouth.
your breathing was okay?
Well, okay.
Okay.
Every night this week, nothing, except for last night.
All right.
It started again last night. I thought, well, what's going on here?
Feels like something's going to pop out of my ear.
Okay, nice.
You have your tea, you're not drinking your tea.
Coffee, it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
And when I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees?
Both knees. And
Elbows?
elbow. And when I do like that, when you do like that, I wanna,
What do you mean?
but when I breathe in, you could feel a pain around here and all that.
Right. Is your vision normal?
Yes, a vision. You know, sometimes I get the vision. Sometimes it's like, the light, not this kind of light, like the bulb.
Yeah.
The bulb like a zigzag, but it
A halo?
what is it? No, halo is round.
Oh,
This is not a round. It's like a zigzag.
okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe
Take-
slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't really. I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right?
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, yes, when you press
At the back?
right there, sir. Right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the
Yeah.
edge for me.
like somebody was bashing me. Oh,
All right. Can you put both hands behind your head for me?
yeah.
Can you push your elbows back? Does that hurt?
A little, not much. A little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see, oh, this one's there.
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cold. Feel my arm.
Oh yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
All right.
Why I wake up with this pain?
I'm Paul, healthcare assistant here. Come for your blood test.
Oh my God.
Is this your natural hair or is this artificial hair?
Yeah, natural hair.
Sorry, it's squirted. It's definitely a cyst from the fact that it's squirting everywhere.
I've done blood tests quite a few times and it's quite difficult to
Really?
find out, yeah.
I like a challenge. Yeah, got it.
You can have the record for most wax down your ear. Oh my God. Yeah.
Come through. Right, I'm Karen.
Thank you. How are you?
Sit here for me.
Yeah,
Lovely.
exactly.
Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954. So it's going to be a long, hard job. I'll cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator or the you know, the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum, because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah.
You're going to give it a go?
Oh, certainly.
OK, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me?
Yeah.
Thank you, sorry. I've got my colleague with me because his machine's working and mine's not.
How are you?
So this is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. OK, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you stop, that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah. So the plan of action will be, I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum,
Yeah.
will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on, then.
Come and have a seat over here again.
What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. Oh, I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50.
So I think the way to do that is with a blood test today. Yeah. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
Oh, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one? Oh, how old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah, room 1. Hold this for me, please. I can get them. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Thank you very much.
Pleasure. I hope you feel better soon.
Okay, thank you.
Okay, wonderful stuff. Take care. Thank you.
Nice to see you. Bye-bye.
Bye-bye.
Would you say thank you to the doctor?
You're welcome. Are you going to let your mum put the cream on so it gets better? You're welcome.
Brilliant.
Right.
Thank you very much for that.
Okay,
That's great.
nice to see you.
Nice to see you.
Bye-bye.
Thank you.
Bye, thank you.